So if you just switched on the radio, welcome. I have been learning an awful lot this afternoon about menopause, or something that a lot of the papers talking about today. This is male menopause, the technical term also called andropause as well. This has been in the papers because there's been one ambulance service which recently said that it would consider requests for paid leave for men who are going through this. And so it got me thinking about what are the symptoms? Why does it happen? Well, Phil actually went through this as a side effect of treatment from prostate cancer.
When they give it to you, they do say one of the the side effects is you might get hot flushes, you'll get mood swings, you'll put on weight. Many men kind of get very sensitive breast areas, and they do describe it as being. They say it's like the male menopause. And certainly, that was the case for me. Not initially. I had it over 3 months, and I had a monthly injection, basically. So you have an implant, and the first couple of months weren't so bad. But the third lot I had, which ran up to Christmas last year, really did have an impact, and a lot of hot flushes, a lot of pains in my muscles and my joints, putting on weight certainly, and the mood swing thing. I had a complete. I mean, between you, me, and the gatepost, anybody else that's listening that cares, I had a complete meltdown over Christmas over something really bizarre and innocuous, like we'd run out of biscuits for cheese or something like that, and I went, oh man, you'd have thought it was the end of the world.
Phil being really honest about the symptoms that he's been through. I wanted to delve into this a little bit more with Dr. Jeff Foster, who's an expert in men's health. And he's been telling me that actually it's much more complicated than just, being described as this male version of the menopause.
So the true condition is testosterone deficiency, and it's been around for decades. There is bucket loads of evidence about it. The problem is that from an NHS perspective, it's been kind of trivialised a little bit, and I think the media took the name male menopause or andropause or menopause or whatever you want to call it. But the condition's there. It's been around for ages. It's just the terminology perhaps has not been used correctly.
What is happening then at this stage in a man's body?
I think the best thing is to compare it with menopause in women, and that's where the whole conflict and also the terminology, the use of the word menopause came from. So average guys produce their peak of testosterone at the age of 30, and then we naturally lose about 1% a year. And if you're really lucky, you might be born with loads of the stuff and you never drop your testosterone, you feel absolutely fine. And yet for about a quarter of all men, so 25% of all guys at some point in their life will have low testosterone. Now, of course, that doesn't mean they all need treatment, but they will have low testosterone. Their levels will drop. And then for a proportion of those guys, they will have major symptoms which are mimicking menopause in many ways. So most guys get symptoms of things like feeling more tired, more grumpy, like they just don't enjoy life anymore. You might find that you go to the gym, but instead of gaining like you used to, you just seem to be getting fatter and you're putting the same effort in. You're not eating anymore, but your body's changing. You often find that you're just less interested in sex. It's not automatically just I've got erectile dysfunction. It's more just being like, I'm not so bothered about it anymore. And the big problem is if you were a woman and you went to the doctor and said, look, I've lost my libido, my body's changing, I've got brain fog and I can't concentrate on anything, they're going to say, well, you're menopausal, it's classic. Whereas if you're a guy, the problem is that most of us are told, well, that's just normal. You're a guy in your 40s, you're in your 50s. That's what you should be. You've been married for 10 years, you don't have sex anymore, you've got kids, you can't eat properly. So it's all kind of pushed down to something that's sort of cultural and societal narrative that says this is the normal thing for a guy as he gets older.
The other thing that I've been hearing as well today, as people explore this a little bit more, is that it can also be misdiagnosed as perhaps entering into depression, for example.
Yes. So a lot of guys come in with other symptoms. So you might just feel down. You might just feel like your mood is gone. You might feel that you're just not yourself. And of course, if your primary symptom is not also some sort of sexual dysfunction, well, then quite reasonably, your doctor's going to say, well, you're depressed. So we give them antidepressants. And it can take, the average time it takes for a guy to see me in clinics about 3 years after the onset of their symptoms, because most of them will do anything to avoid seeing a doctor or quite often get the wrong diagnosis.
Once you do pluck up the courage to go and seek help, how can this be treated?
So For some proportions of patients, you can do it through lifestyle changes. But I have to say this is an incredibly low number. So the vast majority of patients with diagnosed low testosterone need to replace their testosterone by medication. And it's just like male HRT. And we give these guys testosterone either in the forms of gels or creams or injections, and it's kind of what works best for that patient.
The extraordinary thing about this, Jeff, is the fact that I'm only learning about this now, and I think this will be the same for a lot of people. I wonder what that says about this time in a man's life and how we view it.
I think the best comparison is where menopause was maybe 10 or 15 years ago. And certainly when I was at med school, menopause was just considered a normal process. You go through menopause, you might feel awful, but it's natural. So suck it up and get on with it. And that's what the attitude really was. So all these thousands of women were struggling with menopausal symptoms. And now that's all changed, hopefully for the better, maybe not completely, but it's certainly in the right direction. And then guys are now starting to realize, hang on a minute, we've got our hormonal issues. And again, this is not a competition. We're not trying to say guys are trying to outdo women on the menopause side, but just to say that there's an equal problem with guys suffering a low testosterone picture. To have that awareness it's not surprising that a lot of docs don't know about it, and a lot of patients don't know about it, because all these sort of midlife conditions that were not really thought about 30 or 40 years ago are now starting to become more important. We're all living longer. We all want a better quality of life. I don't want to be 45 and never be able to have sex and feel really down and depressed all the time, feel grumpy. I'm only halfway through my life, I hope. I've got lots to do, and I don't want to spend it feeling awful.
Well, as you were saying that, yeah, I do hope we're only halfway through our lives there, Jeff. Thank you for giving us such important information. If you're worried about this, what do you suggest?
You can try your NHS route, and some doctors are really good at this, and we're trying to educate as many doctors as we can in this area, but it is still a relatively progressive area. So I think there's free access to loads of information on our website, which is either h3health.co.uk or just my name, drjefffoster.co.uk. And there's lots of free information on there that you can get. The first thing is to discuss it with a doctor. I wouldn't necessarily just go and get a random test from somewhere, because again, without knowing it in context, you might be falsely told everything's normal when actually, of course, it may not be. So I'm always happy to offer advice to people. We don't charge that sort of stuff. Just to try and get awareness is really important. And hopefully we can kind of change the way that people think about men's health in the next 5, 10, and hopefully 20 years.
Dr. Jeff Foster, who's an expert in men's health, I think doing a really great job of explaining what we mean by andropause, or it's colloquially being called the male menopause.